Here is your stem. Once you're ready, you can tell us and we'll begin.
Okay.
All right. So if you've read and understood, considering it communication skills station, please begin.
Hello.
Hello.
Yes, I'm Dr. Maher, one of the surgical doctor here. Working with Mr. Man. I'm calling to speak to the on-call consultant to update him about one post-operative case of oliguria. Can I check that I am speaking to on-call consultant?
Yes, summarize your case.
Okay, and this is Mrs. Sarah, 69-year-old lady. She is post-operative day 1 for elective hemicolectomy, for right hemicolectomy, for cecal tumor with liver biopsy, for suspected metastasis. She's having this persistent tachycardia, and she is having 120 pulse rate. She's hypotensive also, and post-operative she have drop of hemoglobin, and for that she received 2 units of blood. Her lab investigation, creatinine 116 and urea 16, and her ECG was normal. Chest X-ray was clear and abdomen was soft, and urine output 10 to 20 ml per hour in the last 8 hours. But she received only 110. She received only 1100 of normal saline. So I checked for the catheter. It's not blocked, and consider this. For me, this is oliguria due to low intake of fluid. So can I have your advice, please, about this?
Okay, what do you think the cause is?
Yeah, I think the cause is under hydration of the patient. So this is pre-renal.
Okay.
Yeah.
And what about creatinine? Is it normal?
Yeah, it for the creatinine is 116. It's a little bit high.
Why is it high?
Because the patient have pre-renal renal failure, this acute kidney injury.
Okay. And what's your plan of action in this situation?
Yeah, I think this is pre-renal. As this is pre-renal, I consider giving the patient fluid bolus of 500 to ml of crystalloid. Then I can repeat it. And
Okay, for many time.
I can repeat it for 4 times. Yes, 4 times. So that and I will assess the urine output and hydration state of the patient. But
Okay. If there is no response after 4 times, what your
yeah, if no
actions?
response, then I will call the ITU registrar, and I'm considering the HDU registrar. I'm considering shifting the patient to the HDU.
Mm-hmm. And how you monitor the response to fluid challenge?
I will monitor using the urine output of the patient, the blood pressure, pulse rate, capillary refill time, and
Okay. Do you
also
think this patient is bleeding?
yes, she may have bleeding, but for now the abdomen is as the abdomen is benign, abdominal examination. So I will just consider doing serial abdominal examination, and if there is any peritonitis, signs of peritonitis or any tenderness, then I will give you an
Okay.
update.
Do you think it could be an anastomotic leak?
It's possible for patient postoperative for after anastomosis, but for now the patient is the abdomen is. I told you this is no sign of peritonitis, so I will consider the oliguria is the main as
Okay.
the
Yes.
underhydration is the main cause.
Does the patient need re-explorations operation now?
No, for the meantime, no need.
Okay, and is the patient require HDU transfer? Does the patient require HDU transfer?
May need, but for now, no need. Just I will start at the ward, the fluid bolus, and if no response after 4 times, then I will shift to HDU.
Okay, and if you need to shift patient to the HDU and there is full bed, how can you manage this problem?
I will monitor the patient at my ward side. Then I will continue, and I will call the bed manager, and I will speak to him to make an like any if there any opportunity that he can create a bed in the HDU.
Okay, and do you think the patient is shocked?
Yes, for me the patient is having.
What type of shock that might have?
Yeah, he have hypovolemic. She have hypovolemic shock, as she is tachycardic.
Is this patient need hemodialysis?
No, for now, no need for hemodialysis, only
What the indications of
rehydration.
hemodialysis?
Yeah.
What's the indications of hemodialysis?
Indication is either severe acidosis with pH less than 7.2, hyperkalemia with potassium more than 6, and if there is pulmonary edema.
Okay, please summarize your case. Summarize the plan.
Yeah, we're speaking about this Mrs. Sarah. She is postoperative day 1. She's having oliguria, and she's only she took only 1100 ml of normal saline in this postoperative day, and I will start bolus of fluid, and I will repeat 4 times until gaining response. If no response after 4 times, then I will consider shifting the patient to the HDU, and I will give you an update about that.
Okay, thank you. Please keep me updated.
Thank you very much,
Mr. You still have 1 minute. Your time. Can you tell when the blood labs were done?
Yes, this blood lab, I don't know the time exactly, but I will check and I will give you an update about this.
When do you plan to send new blood labs?
As soon as I am off the phone, I will try to send a new lab set, if this is all.
All right, so you don't have an idea what the hemoglobin level would be now after patient has received 2 units of blood? Is that right?
Yeah, yes.
Okay, right. Okay, you can keep monitoring and send the patient over.
Okay, thank you.
30 seconds. Yes, good. Thank you.